So what do nearly all coronavirus cases have in common? So that's what we're going to talk about today, and how you can use this information to help keep yourself healthy and keep from getting sick. So my name is Dr. Tom Rofrano, founder of the Natural Medicine Clinic in Palm Beach Gardens, Florida, and I've had the opportunity to see over 100,000 patient visits over the last 34 years. And I was looking at some recent research. There's a study in the Journal of the American Medical Association that just came out, reported that over 94% of patients in New York that had died from coronavirus had an underlying health condition. A study prior to that indicated that 99% of fatalities in Italy from the coronavirus had an underlying health condition. And the most common health conditions they're reporting are high blood pressure, diabetes, heart disease, obesity. So the number one being high blood pressure. And what all these have in common is their diseases of lifestyle. Is that something most people can do something about and help turn this around. They're also the underlying root cause of all of these, the heart disease, high blood pressure, diabetes, is inflammation, insulin resistance. So again, what's great about this is there is something most people can do something about and help turn this around. So how do we turn this around? Well, the most important thing, of course, is diet, but it comes down to diet, exercise, stress, and just overall deciding what it is that that is important to you as far as your health. So for instance, if you are a family member has high blood pressure, we'll take that, since it seems that about 50% or more of Americans have high blood pressure. That would be a good place to start, and that is the most common underlying issue in the above studies that they mentioned. So with that, if you look at and they're also talking about, well, why high blood pressure? Why is there such a high incidence of patients that have had serious consequences of coronavirus with high blood pressure? So they're thinking, well, possibly is the medication they're taking. Well, in any case, what you can do about it to help turn it around, I'll give you an example of a patient I saw not too long ago, a 68-year-old woman, and besides having high blood pressure, she came in with pain, fatigue, brain fog, vertigo, insomnia, digestive issues, and she was overweight as well. So to kind of outline what we did that can also help you or a loved one that has high blood pressure or these other inflammatory related conditions, as far as diet, we put her on an anti-inflammatory diet. So I call it the free diet because it's a diet free of those foods most commonly responsible for inflammation and other chronic underlying health issues. So it's free of not only gluten, but gluten, grain, sugar, yeast, dairy, eggs, soy, legumes, nightshades, and processed foods. So initially it's free of those foods. And we put her on this free diet, this anti-inflammatory diet, and in 4 weeks, when we rechecked her blood pressure dropped 66 points to normal level. Also, she normalized her glucose or blood sugar, her triglycerides, inflammatory markers went down to normal, and she lost 12 pounds in the process in these 4 weeks. So that's a simple strategy you can use to help turn these things around, these chronic inflammatory lifestyle conditions, the high blood pressure, high blood sugar, prediabetes, diabetes, the cardiovascular disease like elevated cholesterol, triglycerides, insulin resistance, belly fat, all of those can be turned around with simple lifestyle strategies. So diet being the most important, and then also besides the free diet, we also did specific supplements with her. I call it the basically start with the functional 5, which is something that most people could benefit from. It's a multivitamin, fish oil, magnesium, vitamin D with K, and a probiotic. And then other specific supplements based on your needs. So for instance, if you want extra immune support, then you add vitamin C, and acetylcysteine, zinc. Quercetin is another powerful immune support supplement. So between diet, supplements, exercise, stress relief, it's a good combination of things to help kind of correct these underlying conditions. And it's a good time. It's a good time now to, while we have this pause, and we are soon going to be coming out of it, to then decide, hey, maybe this is a good time I can use to really get serious about my health and make some decisions to turn this around. So I also will put below a link to a free copy of the Free Diet Phase 1. So if you want access to that food chart, feel free to click on that link below, and feel free to subscribe to my YouTube channel, and I look forward to seeing you next time. Thanks for joining me today. Take care.